Doppler ultrasound and its types. Christian Andreas Doppler is an Austrian physicist. Born in 1803 in Salzburg, Austria, he developed the principle, later known as Doppler effect. It states whether an observed changes in a frequency or transmitted waves when relative motion exists between the source of the wave and an observer. First medical applications of the Doppler effect were initiated during 1950s, and Dr. Ian Donald is credited with the invention of the first medical ultrasound machine in 1958. Color Doppler is an imaging technique that uses sound waves to show the movement of the blood through the blood vessels by measuring sound waves that are reflected from moving red blood cells, as we can see in this schematic. Color Doppler uses computer software to visualize sound waves as different colors that show the speed and direction of blood flow in real time. When blood is moving towards the transducer, it is termed a positive Doppler shift and represented as red flow. It is termed a negative Doppler shift when blood cells are moving away from the transducer and they're represented as blue. It is commonly used to determine whether plaque builds up inside the carotid arteries and blocks the blood flow to the brain. Here we can see normal blood flow within the carotid artery. Also, it is used to determine if the patient suffers from deep vein thrombosis. It occurs when a blood clot forms in one of the deep veins within your body, usually the legs. It can be severe, as blood clot in a vein can break loose, travel through your bloodstream, and get lodged in your lungs, blocking the blood flow and causing pulmonary embolism. Continuous wave Doppler is primarily used in cardiac ultrasound, where sound waves are sent and received continuously, allowing to determine the speed at which blood flows more accurately. Transducer is designed to simultaneously emit and receive reflected sound wave. Doppler echocardiogram records echoes from red blood cells. The speed and direction of the blood flow indicate how well blood gets around and inside the heart. It can provide a healthcare professional with insights into health of the heart and if it's affected by coronary artery disease or heart valve malfunction. Coronary artery disease can be treated by angioplasty, a procedure used to open blocked coronary arteries and restore blood flow to the heart muscle without open heart surgery. A long thin tube is put into a blood vessel and guided to the blocked coronary artery. It has a balloon at its tip. Once the catheter is in place, the balloon is inflated at the narrowed area of the heart artery and presses the plaque or blood clot against the sides of the artery, making more room for the blood flow. Then a stent, an expandable metal mesh, is put into a newly opened area of the artery to help keep the artery from narrowing or closing again. Spectral Doppler. It interprets blood flow information into a graph alongside with colored image. It is used to quantify the amount of blood flow and resistance within the blood vessels. Each part of the systolic peak represents the range of different blood velocities at a given time. The highest point of the peak indicates the maximum velocity. Power Doppler is a newer type of color Doppler and more sensitive than conventional one. It is used to study small vessels with low blood speeds as it overlays Doppler information on a grayscale image and shows the energy within the vessels. It is used to show the blood flow within the internal organs. Thank you.